Hello there, welcome to my channel. So today I'm going to talk about the different medical tests or medical assessments which you need to perform, you and your partner, before getting married. So most people or most partners ignore the fact that they need to do a medical assessment. They just assume that both of them are medically fit to get married. So they do not undergo these medical tests, which I'm going to mention in this video, which are essential. The purpose of doing a medical test is not to cancel your wedding. It's not to make you not to get married, but it is there so that it can help you, so that you can understand on how you're going to help each other in dealing with different medical conditions. It can help you to prevent you from getting different infections. It can also help you to help your partners or help yourself, so that you can get the different medication for your diseases or infections, to get treatment, and also to get consultation on matters affecting your health. It can also help you because marriage is a lifelong commitment. It can help you on how to plan to get quality and healthy kids for you and your partner. So it is essential that you undergo this medical test, so that it can help you to plan in the long run on how you are going to manage your relationship, and also on how you are going to manage to get your kids. So it is an important factor. It is an important thing before you going there and doing a wedding. It is important before eating that cake, before saying yes I do. It is important that you go and do a medical test. So today I'm going to mention 8 medical tests which are essential for you and your partner before getting married. And I'm going to talk about the importance of each medical test. I'm going to mention the tests and tell you the importance of each medical test. So welcome to my channel. For those who are new to my channel, my name is Maxwell Wabwire, and in this channel I discuss about different medical information. So remember to subscribe to my channel. Don't forget to like the video, and also remember to leave a comment down in the comment section below. So without wasting more time, let's get started to the video of today.
I be so sick of you niggas, y'all contradicting. I be so bored myself when you come and fuck me. I feel so ordinary, except when you around me. Treat me like water while you wear me out. Arguments, you air me out. Tripping about you.
So welcome again. So the first test which you need to do, the first and the most important test which you need to do is doing a HIV and AIDS test. So this is whereby you go to a clinic or to the hospital, and you ask the doctors or the personnel in the hospital, so that they can help you know your HIV and AIDS status. So you understand that HIV is a lifelong disease. It affects your body's immunity and its ability to fight infections. So performing a HIV and AIDS status test will help you in the following ways. First of all, it helps you to prevent yourself from getting HIV and AIDS. If you find that your partner has HIV, you can make plans on how to prevent you from getting HIV and AIDS. Your partner having HIV and AIDS does not mean that you cannot get married, because there are different ways. There are medications which they can use, and there are different ways which you can live together as discordant couples, whereby you find that one of you is positive and the other one is negative, but you are living together. The second importance of doing a HIV and AIDS test is to help your partner. If you find that your partner has HIV and AIDS, or if you find that both of you have HIV and AIDS, you can plan on how to access the medications and to access the medical consultations about HIV and AIDS. This can also help you to plan on how to get kids, whereby you will know on how to get healthy kids without infecting the HIV and AIDS to the children. And also finally, it can help you so that to help you to protect yourself. If you find that both of you are negative, are HIV and AIDS negative, you will put down measures so that to prevent both of you from getting HIV and AIDS infections. The second test which you need to do is sexually transmitted diseases and urinary tract infections medical test. So sexually transmitted diseases and urinary tract infections present themselves in the following ways. It can present in form of sore in your genitals, discharges. It can present in terms of pain, and it can also prevent in terms of rashes and warts in your genital areas. Some of the sexually transmitted diseases do not present with any signs. So you might just get married without any of you having the signs and symptoms of the sexually transmitted diseases. But later in your marriage, you find that because one of you had the disease, the person will transmit the disease to you, to the other partner, which will make them get infected with the disease. So, examples of the sexually transmitted diseases include gonorrhea, chlamydia, syphilis, and genital herpes. So, it is important for you to do STD testing so that to prevent you from getting infected with sexually transmitted diseases. It can also help you so that you can know on how to access medication, because most of the sexually transmitted diseases, except HIV and AIDS, have treatment. They can be cured. So you can plan on how to get treatment before having sex with your partner so that you prevent yourself from getting infected. Also, it can help you to prevent getting complications that might arise due to untreated urinary tract infections and sexually transmitted diseases. These complications include infertility. When you do not treat some of the diseases, you might end up getting infertility. You can also get ectopic pregnancies, and there is also an increased risk of getting HIV and AIDS when you have the UTIs and the STDs. The third test, the number three test which you need to do with your partner is doing a blood group. So blood group will help you in knowing two things, whereby you do a complete blood count, whereby you ascertain the level of blood in the body, and you can also do the rhesus factor. These two are the most important things in terms of your blood group. So understanding your complete blood count of the HB level will help you to understand if either of you has anemia. Anemia is the low amount of blood in the body, and when you have this low amount of blood in your body, you can put on measures so that you can get to increase the level of blood in the body. So these two factors are important in terms whereby you're going to get pregnancies. They are the most important during pregnancy because anemia affects your ability to sustain a pregnancy. The second factor in terms of the blood grouping is the rhesus factor. Sorry for the noise. The second thing about blood group is the rhesus factor. This is whereby you find that you are either rhesus positive or rhesus negative. When you go to the hospital and do a blood test, in terms of the rhesus factor, they will tell you that either you have blood group A, B, AB, or O, and they will also tell you that either you're O positive or O negative, A positive or A negative, B positive or B negative. So the positive and the negatives imply the rhesus factor. And understanding the rhesus factor is important because in marriage, because you might find that your wife either is a rhesus negative. When you do a blood testing and you find that both of you are rhesus positive, there is no much implication to that. And also, when you find that your wife has a rhesus positive blood test, that also does not have any implication. The problem comes when you find that the father is a rhesus positive and the mother or your wife is a rhesus negative. So you'll find that in this condition, there's something called the hemolytic anemia. So when you have a kid, when a rhesus positive father has makes the wife pregnant, most of the time the first kid will just be born very well. After the first pregnancy, you'll find that the mother's body will form antibodies which will fight the rhesus factor in subsequent pregnancies. So the second time whereby you're getting pregnant, because the father is rhesus positive and the mother is rhesus negative, the mother's body will form antibodies which will fight against the presence of the rhesus in the blood of the newborn. So you'll find that at the end of the day, you might get a lot of miscarriages and abortions, constant miscarriages and abortion, and you'll be wondering why you had your first kid was born just very well, but getting other children will be a problem because of the constant miscarriages and abortions that might be occurring because of your rhesus negative blood grouping. So understanding the blood grouping of you and your wife is essential because it will help you to access treatment in times whereby you are planning to get pregnant. You might consult with your doctor on how to plan so that they can get the anti-D injection so that to prevent miscarriages and abortions that result due to the rhesus negative. Okay, the number 4 test which you need to do, you and your partner, is doing a sickle cell disease testing. So this is whereby you go to the hospital whereby they perform a test so that they can ascertain if you have either a carrier of if either of you are carriers of sickle cell disease. Most of the time you might find that people who are carriers of sickle cell disease, most of the time they do not show any signs and symptoms of having sickle cell disease. So both of you might be healthy but might be carriers of sickle cell disease. So sickle cell disease is a severe a disease whereby you find that it leads to the formation of abnormal red blood cells, and with this malformation of red blood cells, you'll find that there's also a high hemolysis. Hemolysis is the breakdown of red blood cells. So most people who have sickle cell disease, you'll find that they will have constant anemias because of the increased abnormal red blood cells and also the increased destruction of the red blood cells. So most of the time you find that they will have something called the hemolytic anemias, and having hemolytic anemias will require somebody to do a blood transfusion. So you need to do a sickle cell test so that you and your wife prevent you getting children who have sickle cell disease. You can choose to do other methods such as adoption so that you can get kids, or you can do assisted deliveries so that you can get kids and avoid getting kids with sickle cell disease. So having a kid who has a sickle cell disease is mentally draining and also financially draining, emotionally draining, and also physically draining, because most of the time you find that children sickle cell disease has a very high mortality rate. Mortality rate means that high mortality rates means that most or a high number of children born with sickle cell disease will end up dying. Yes, increased number of children with sickle cell disease will end up dying and living poor quality of life. You also find that most of the time you will always be in the hospital because your kid will always be having a reduced level of blood. Yes, you can go to the hospital, you do 2 transfusions or 3 transfusions, then you are discharged. But after 2 days, you are back to the hospital because the level of blood has declined. So we'll end up spending most of the time in the hospital. And you find that when you have your kid in the hospital, you will also be emotionally drained because you cannot work properly. When somebody in the family is sick, most of the time you find that the whole family is always sick. They might not be physically sick, but they are emotionally and mentally sick. So it is important. So you might also be finding that you will spend most of your time going to the hospital and back. Most of the time you're going to the hospital and back. So it is important to do this test so that to prevent getting such. So having a kid who has sickle cell disease is also financially draining because this kid will also be depending on blood, will always be depending on blood transfusions. you can do like 10 transfusions or 20 transfusions per month. And with the current economic times, at the place where I'm working, at the cost of blood, one blood transfusion is around 5,000 to 6,000, from 4,000 to 6,000 Kenyan shillings. So when you do, let's say, like 10 transfusion, that will mean that you need around 50,000 or 60,000, so that to cater for the amount of transfusions which your kid is having. So to prevent this from occurring, it is important for you and your wife to do a sickle cell test, so that you can know your abilities and your capabilities of getting kids who have sickle cell disease, and prevent all this from happening. The other test which you need to do is doing a mental health assessment. So mental health assessment is assessing the psychological well-being of you and your partner. So you need to identify if your partner has different conditions such as autism, cerebral palsy, schizophrenia, bipolar disorders, and stress disorders. I know it is called the depression and anxiety disorders. So by doing the mental health assessment, that is when you can know that if your partner has this condition. And these conditions can really strain your marriage. So when you understand that your partner is having this condition, it will imply that you will need to make measures, and it will make you be understanding that your partner it will make you understand to make measures which can help you cope with your partner. Mental health affects the way we behave, the way we think, and the way we make decisions, and the way we cope, and the way we relate with each other. So it is an important factor because it will affect the way you and your partner will relate to yourself, and this will help you to prevent complications that might arise due to untreated mental disorders. This include increased cases of suicide, increased cases of drug abuse, and increased cases of depression and deaths that might arise due to untreated mental conditions. The number 6 test which you need to do is assessing the presence of chronic medical conditions. So these conditions are chronic medical conditions are lifelong medical conditions. These include asthma, diabetes, hypertension, and epilepsy. So when you are understanding the presence of these diseases, should not make one to stop the marriage, should not make one to cancel the marriage, but to make informed decisions. And also, this will help you to make combined efforts. You and your partner, you need to make combined efforts, so that you can know on how you're going to help each other. For example, me, I had one of my ex-girlfriend had asthma, so and we were living with her. So I knew the medications which she was required to be taking at and the exact time whereby they needed to take the medications. I knew the different kinds of medications which they will use. When this one does not work, I know I'll go and use these medications. And I knew the threshold whereby I know that this one now, the medications will not be helping us. So I need to take her to the hospital. So it is essential that you understand that in your partners, and that will reduce the financial burden to you and your partner, because of your combined efforts. At the end of the day, you'll find that you will have reduced the amount of times whereby you'll be going to the hospital, because you have you have understood on how you're going to take care of each other. Another important test which you need to do is doing the fertility testing. And fertility testing, there's no test called the fertility test. A fertility testing is a combination of different medical tests. This includes doing a blood test whereby you ascertain the levels of hormones in blood. You can do a pelvic ultrasound whereby you check the ovaries, you check the fallopian tubes, you check the uterus. You can do the semen analysis whereby you can do a sperm count, sperm volume, and different facts about the sperms. And this will, first of all, will assess your ability to get kids. Obvious, when you're getting married, the first thing in marriages, or the first blessings in marriage, is on kids. So before getting married, you will have ascertained, you will have known, you have assessed your ability to get kids. Also, when you do this test and you find that either of you is not has a disorder, it can help you to access on plan on how to access the different treatments available. It will also help you to do family planning, whereby you will know the amount of kids whereby you need to have and the spacing in between the kids. That's what we refer to as family planning. So assessing fertility is also helping you in assessing if you are going to use the different family planning methods. If you are not fertile, there's no need for you to do the family planning. Also, doing the fertility testing will help you to explore different options of getting kids, including adoptions. The last test which I'm going to talk about in this video is doing a general body assessment. So this is whereby you look at factors such as height, weight, and blood pressure. So you need to know the height of your partner. You need to understand the weight of your partners. You need to know if they are having obesity. When you do the height and weight testing, that is when you can calculate the BMI. When you calculate the BMI, that is when you can know if they are obese or when they are underweight. So when you understand those things, you can know on how you can help your partner. Either you can feed him or her very well so that she can cease from being underweight, so that she can add weight and move from the underweight to the normal weight. Also, when you find that they are obese, you can take them to do exercises. You can go for a nutritional consultation so that you can know the kinds of food which he or she might be taking, so that they do not continue become obesity because of the complications that usually arise due to being obese. So with that said, I've come to the end of my video, whereby we have talked about the 8 medical tests which you need to do before marriage. And as I'm going to repeat this because I've said this, that medical tests are not tests which should cancel your marriage, but should be the tests which help you make informed choices and decisions about helping each other and on how you're going to relate with each other in your marriage, because marriage is a lifelong or a lifetime commitment, and it requires a lot of commitment. So before telling that one that you are going to commit them in good health and in they say in good health and yes, kwa raha na kwa shida, yes. Before committing to that, you need to understand them. If you are able to cope with them in that condition, you need to ascertain if you can live with somebody who is HIV and AIDS positive and you are HIV negative. You need to understand to think and assess if you can live with somebody who has diabetes or somebody who has asthma while you're not having asthma. You need to understand the different things and the different ways whereby you can do so that to protect yourself from getting the different infections and the different diseases. So with that said, I have come to the end of my video. Thank you for sticking to the end. I just want to remind you that please consider subscribing. Don't forget to like the video, and also don't forget to leave a comment down in the comment section below. So with that said, bye bye for now. Let's meet in my next video.